Neuroimaging has a really important role in the diagnosis of cerebral palsy. Abnormal imaging is identified in over 80% of those with cerebral palsy. But it's important to remember that cerebral palsy is a clinical diagnosis, and normal MRI scans and ultrasounds don't exclude the diagnosis of cerebral palsy. A number of studies, both in Australia and internationally, have identified that up to 15% of people with cerebral palsy have got a normal MRI scan. This is important because sometimes people are reassured by a normal MRI scan and think that a different diagnosis is at play. Obviously, we all worry when a scan's normal that something else might be going on, and there's a large push both nationally and internationally to help us diagnose what in fact is happening in these children. One of the nice things about an MRI is that it helps us see different patterns, and that can help us identify different sorts of cerebral palsy. The most common thing we see is changes in the white matter, particularly around the ventricles, the so-called periventricular leukomalacia, or changes in the deep grey matter of the brain. An MRI also provides lots of useful information about early changes in the brain. Changes before 20 weeks present as changes in the way the brain folds or abnormalities of cortical migration. Abnormalities of cortical migration are important because sometimes they're genetic, and so the situation might recur. An MRI can provide information about the cause of cerebral palsy, but it won't tell us 100% what's happening. In terms of the severity of cerebral palsy, we get some clues from the MRI, but we don't get everything. An MRI with changes in the deep grey matter, the basal ganglia, may indicate that the child is more likely to have quadriparesis and may indicate that it's therefore more severe. Sometimes we see extensive white matter changes, and this would again be associated with a more severe sort of cerebral palsy. An MRI at term equivalent age should be done in children who are preterm who are high risk of cerebral palsy. MRIs don't require an anaesthetic. Whether or not to order an MRI in a child older than 6 weeks who might need an anaesthetic is always a difficult decision. If I'm worried about there being an abnormality of cortical migration that might have a genetic cause, then I may order the MRI in that circumstance. If there's ambiguities about what the cause of cerebral palsy might be, then an MRI might be useful. Otherwise, most people would recommend waiting until the child's at 2 years of age or older before undertaking that MRI so the most information can be gained.